I'm John Strum, and this is Real Talk MS. It's March 18th, and we have a lot to talk about. Next week, a couple of hundred MS activists will gather in Washington, D.C. for the National MS Society's Public Policy Conference. As many of you know, this is something that I look forward to every year, but I'll admit this year feels different. The timing of the Public Policy Conference could not possibly be better, as we're seeing cuts in funding for MS research, layoffs in every major governmental agency that impacts our healthcare, including the National Institutes of Health, the FDA, CDC, Health and Human Services, and the VA, and even Medicaid funding is being seriously threatened. Advocacy has never been more important than it is right now. So I'm devoting this entire episode of the podcast to a conversation with the National MS Society's Vice President for Advocacy, Steffany Stern. And I'm hoping that after you've listened to my conversation with Steffany, you'll visit nationalmssociety.org/advocacy and get involved. I can't imagine that there will ever be a time when your voice is as urgently needed as it is today. In a moment, you'll hear my conversation with Steffany Stern. Next week, a couple of hundred MS activists will gather in Washington, D.C. for the National MS Society's Public Policy Conference. As an MS activist, this is something I look forward to every year, but I'll admit this year feels a little different. As we're seeing cuts in NIH research funding, layoffs affecting the FDA, CDC, Health and Human Services, and the VA, and even Medicaid, a healthcare safety net that serves hundreds of thousands of people with MS. Even Medicaid funding is at serious risk. Well, advocacy has perhaps never been more important than it is right now. Joining me to talk about what we can expect at this year's Public Policy Conference is the MS Society's Vice President for Advocacy, Steffany Stern. Welcome back to the podcast, Steffany.
It's a pleasure and an honor to be here talking with you. Thanks for having me.
Before we get into the specifics of this year's Public Policy Conference, can you share some thoughts on what's happening right now in Washington and why this year advocacy should be particularly important to people affected by MS?
That is a great question to start the conversation. It is a very busy time in Washington, and it's also a busy time in state legislatures around the country. I should point that out. I know a lot of folks are engaged at the state level as well. Every 2 years we get a new Congress, and every 4 years we have a new presidential administration. And this year we've got, both are new, and we are in the first 100 days of the Trump administration. I think it's safe to say that this president came in with a lot of plans and a lot of policy proposals and changes, hit the ground running, and has implemented already quite a lot of changes to our federal government in terms of this staffing and funding and how it's operating. The Congress is filled with a lot of new members. There's a lot of returning, veteran members as well, but there are a lot of new faces, new staff members that we've been meeting with who may or may not know much of anything about multiple sclerosis or about the issues that really matter to people affected by MS. So we're at a moment in time where we are doing a lot of awareness raising among our elected officials, among staff within Congress and within the administration, making sure that everyone knows, again, what is MS and what are the priorities that matter most to people affected by MS. What are we asking from our government? I think it's a really amazing moment in time to talk about some of the functions of government and why we care so deeply about advocacy and public policy.
All the more reason why I'm so happy to be having this conversation with you right now. And for the benefit of everyone who started listening to the podcast since last year's Public Policy Conference, tell us a little bit about what the Public Policy Conference is.
It's such a powerful event. I always feel so inspired when I'm there. So we bring together people affected by MS every year for a 3-day, 2-night opportunity. We bring people to Washington to connect with each other and to connect with their members of Congress about the priorities that matter the most for people affected by MS at this moment in time. We'll be gathering in downtown DC. We'll have a series of issue trainings, expert panelists. We will have some external speakers talking about the political context in Washington, including a CNN analyst and a reporter from one of the top Washington papers. And again, time for everyone to connect with each other, share experiences, and get each other ready, get prepared for our day on the Hill. We have 170 or so attendees, and we do over 200 Hill visits on Tuesday, March 25th. And that is such a powerful experience. I always say one of the most effective tools in our toolbox is bringing people affected by MS who are constituents face to face with their members of Congress. Members of Congress are accountable to their voters, to their constituents that they represent, and it is their job and the staff job to take meetings and to listen to what matters to people, what's going on in the district, and hear their requests about policy solutions. So it's just really, it's a personally meaningful event for those who attend. And it also has such an impact on the conversation in Congress. Every year we see how the people who attend this conference are able to influence the outcome of, policy moving through Congress or not moving through Congress. As if in some cases that's what we want for policy to stall instead of to advance, depending on what it is.
Well, as someone who's been in those conversations with our elected officials at prior PPCs, at prior Hill days, I can only tell you everything you've said times 10 or maybe times 100. The impact those conversations have on staff, on our elected officials themselves can't be overstated. It's really a powerful, powerful conversation. Every year, activists who are at the Public Policy Conference and across the country focus on a couple of specific issues at the federal level that affect people living with MS. What are the issues that MS activists will be focusing on this year?
Yes, we have two very timely issues and issues that are of incredible importance for the MS community. The first issue is protecting access to the Medicaid program. And the second issue is protecting and funding MS research. So first, I'll talk about Medicaid. You mentioned in your opening remarks that Medicaid is a safety net program, which is true. It is a insurance program that provides coverage for people living with MS and a range of other low-income people. It gives people access to their healthcare providers, their prescription drugs, their rehab, and long-term services and supports, including home and community-based services. So people who have disabilities or chronic conditions can stay at home and receive care in their home and continue to be as healthy as possible and as safe as possible in their homes. We estimate that around 15% of people living with MS are covered by Medicaid for their insurance coverage. We don't have numbers on the estimates of people affected by MS who get Medicaid for long-term services and supports, the home care. But we know that so many people, especially those who are affected by progressive forms of MS, do access those services. Many people living with MS are reliant on Medicaid access to get transportation to their doctor's appointments, to receive access to durable medical equipment they need, and so many more things. I could go on and on all day talking about how important the Medicaid program is. It's really a lifeline for so many people. Congress right now is unfortunately considering a very deep cut to the Medicaid program. They're going through a process called budget reconciliation, and it's not all that important to know all the specifics of this, other than to say that they're engaged in a months-long process that will ultimately lead to very serious spending cuts, federal government spending cuts. And the bulk of those cuts are anticipated to come from Medicaid. Each committee in the House and Senate has to come up with, has like a target number that they have to meet to reach the budget. And the health subcommittee, the health committee has the largest assignment. It had to find $880 billion in cuts to healthcare. So the problem is that the policy changes to Medicaid of this size and in depth would put the states in a very difficult situation. The federal funding from Medicaid that goes to the states, it represents a serious portion of each state's budget. So the cuts that are on the table right now would ultimately have to lead states to reduce the services that they're covering or cut the number of people served. So we would anticipate millions of people losing access to Medicaid. And we know that for many people across the MS community, especially those who are among the most vulnerable, we just cannot let this happen. So that is such a top priority for us. We have been activating all of the MS activists, our grassroots base, to reach out to Congress, to talk about Medicaid. What does it mean for the MS community? Why is it so important? Why do we need to preserve this access? And we will continue to do that until this budget reconciliation process is over. And I strongly believe that we will have an impact. Congress is listening to us. There is a lot of difference in opinion among the House and the Senate and among members of the House and among senators about whether they should go down this road of cutting Medicaid. And if so, what will it mean? What types of cuts should they even consider? So that's issue one. It's a great time for us to be bringing this to Capitol Hill. The second issue is really, I think a lot of people are probably reading the news headlines about medical research. As you know, because you are a longtime advocate for federal funding for MS research, John, there are two federal funding streams that we have advocated for many years for funding for MS research. They are through the National Institutes of Health and the Congressionally Directed Medical Research Program at the Department of Defense. We call the MS Research Program for short. That is the only federal funding stream that is directly targeted to MS research. And it is run through the Department of Defense because MS is a service-connected condition. So this research is done on behalf of the tens of thousands of veterans who live with MS. The research benefits all of us, everyone who's affected by MS. It funds really, high risk, high reward projects. It has been an incredible source of research developments and findings. That funding, we are going to be asking for $22 million for the MS research program at the Department of Defense. That's $2 million more than we have been getting for the last several years. It's been flat funded since fiscal year 21. So we're due for an increase. We are at this moment in time also fighting to make sure that the CDMRP, that the MS research program at the Department of Defense continues to exist. There's a brand new debate happening in Washington about whether the Department of Defense should be maintaining this research and at what level. So we will be, again, educating Congress about why do we need this and why is it so important to us in addition to the National Institutes of Health funding. I think there's a lot of misconception on Congress among members of Congress about why do we have two different sources of research and why can't they just be combined? Well, we know from our scientists across the research community, they're very different. The National Institutes of Health is the country's premier biomedical research institution. It's the largest funder of biomedical research in the world. I think the most fun fact about the NIH is that all of the MS disease-modifying therapies, every single one, is available today as a result of basic research funded by the National Institutes of Health. We estimate that the MS got $110 million from NIH last year, but again, it's not like earmarked in the spending bill. It's just, it goes to NIH and they channel it towards different projects and institutes. So we are tracking closely what's going on with NIH funding. There have been cuts proposed, very serious cuts to NIH funding, as well as staffing reductions. And we are very worried about what that might mean for MS research. We are going to be advocating for just again, sort of like a high level request, which is to protect and fund MS research. And that will include the NIH and the CDMRP at Department of Defense. We'll have to go into each of them a little bit. It's sort of a two-part funding ask, but because there's so much debate right now about federal funding for MS research, we know that we have to talk about both in this climate. So two really just vital and central issues. The activists across the country that I'm talking to are so revved up to talk about these issues. We are activating people to send emails and make calls all the time. We have high numbers of engagement. I have people saying these issues really, really matter to me, and I'm so motivated right now. So I'm really looking forward to Hill Day.
As am I. After listening to you, I'm ready to go today, just so you know. But it's nice to joke a little bit about it. But boy, this is serious stuff. I can tell people, my listeners, a lot of them already know my story. That unfortunately, in caring for my wife, who had a very aggressive case of progressive MS, we lost everything, and that meant for a while we also relied on Medicaid. So I can personally assure anyone who is unclear on how important that is, exactly what it does, what that safety net really means to people who rely on it. And as it relates to the Department of Defense funding for the MSRP, I think it's important that certainly everybody listening to us and also the people on Capitol Hill understand that no one's duplicating effort here. NIH funding is often directed at what's considered basic science, and that is foundational for all of the discoveries, all of the advancements that we see made every day on the research front. That's what the NIH is really good at. Now, what the Department of Defense, MSRP, what that's all about is, as you mentioned, high risk, high reward. So this isn't basic science, but this is the stuff that, yes, it's high risk, and when it hits, it's a home run. And we need them both to ensure that we continue moving forward in terms of what science is learning about MS and all the other chronic conditions as well. There's 73,000 former service members who are living with MS today, and that's how or why this falls under the auspices of the Department of Defense, but we shouldn't ignore them, nor should we ignore the science that's being done as a result of funding the MS research program. So I guess I'm practicing my speech for when I'm in front of.
You're ready to go. You're ready to head to the Hill right now.
I absolutely am. We're actually recording this conversation a couple of weeks before the public policy conference and a couple of days before a potential government shutdown. In the event Congress fails to pass a continuing resolution to fund the government and that shutdown isn't avoided before the public policy conference, what's the plan?
That's a great question. Our staff has been contingency planning. We are always prepared. We in the event of a shutdown, the Hill doesn't necessarily quit working. I actually was on Capitol Hill during one of the longest shutdowns in 2013, and I worked 7 days a week for, I think it was a 3.5 week shutdown, and we were there night and day. So essentially, each office gets to make decisions about which staff are working and which are furloughed. So some offices continue to actually take meetings with constituents, even when the government is shut down. The Hill continues working. The members of Congress don't go home while the government is shut down. They stay on Capitol Hill trying to negotiate a deal until they reopen the government. So they're there, and we know that we would still be able to meet with some people on the Hill in person or virtually. And we also know there will be a lot of events happening on the Hill. There's always, convenings and rallies and speeches every day during a government shutdown. If you go to the Capitol building on the House side and on the Senate side, different members of Congress reserve space, and they, get the TV cameras around, and they have people crowded around, and they're talking about, their priorities and what's going on. So there's a lot of options for us. And we also have some great speakers within the DC area who will be on call to come and meet with us at our conference if it comes to that. We're not sure at this point what's going to happen. You never know right now. I feel everything in DC is so unpredictable these days. So just a different Congress. But as of right now, I would assume that the government will still be, up and running. But like I said, our public policy conference planning team, they are prepared for everything. So we have a plan. And people, if you're a person who's planning to attend the conference, I have had a couple people reach out and say, if the government shuts down, should I still come? And the answer is yes, absolutely, still come.
Yeah, I would underscore that as well. And I had no doubt you had a plan. I'm glad we were able to share it with anybody else who may be thinking, what should I do? It's been my experience that advocating on behalf of your own interests is one of the most personally empowering things that someone can do. And I always try to encourage my listeners to get involved in advocacy. So how can someone go about signing up to be an MS activist? And once they do, what happens next?
That is one of my favorite questions. So I can provide you with the link for your listeners to join our MS Activist Network. This is an email list that you get access to, and we provide updates about what's going on in Congress, and it's also relevant to the state level. And we also provide opportunities for people to email members of Congress. We make it super easy. It's a pre-written message that you can personalize to talk about your own experience and why the issue of the day is relevant for you. We make it as easy as possible to click through on your phone, on your computer, wherever you are, and send a message in. As it takes as little as like 5 seconds. It's super easy. Lately, we've also been doing a call-in script option where you push a button and your phone will dial for you and connect you to your member of Congress. We provide a little script to make it easier for you. We have found the Hill offices are, it's obviously a really busy time. There's a high volume of emails coming in and a high volume of calls, but we have found lately that mobilizing people for like a call-in day has been really powerful to get our message across to the Hill. So just lots of different opportunities to weigh in with Congress, or again, on the state level, we're certainly still very active in advancing policies that are important to people with MS at the state level. And sometimes, again, defending against policies that we believe would be potentially harmful for people with MS. But it's a great way to get just connected to the advocacy work that the National MS Society is doing. We provide invites to webinars where you can learn things like, media training and how to write an op-ed and how to have a really successful visit with a legislator. We do a virtual MS activist rally every year where you can gather with other MS activists virtually and get to know people and, again, learn and hear from speakers. We have a lot going on all the time. We try not to hit people's inbox too much because we know nobody wants to be absolutely inundated with emails, but we communicate with the MS Activist Network list when we have something important, when we want people to know about. So that's the step I would take. You can also reach out to msactivist at nmss.org. I'll also put that in your resources for your listeners, John. If you want to get involved locally and you don't know where to start, just email us and we will get you connected. We aim to find an opportunity for each and every person, no matter what they want to do, no matter if you have 5 minutes per year or 5 hours a week to volunteer. We would love to find something that is a great fit for you and use your voice. So I think we have lots planned for this year, and a lot of it is actually very fun and interesting, and I would encourage everyone to check it out.
I will be sure to include those links in today's show notes so you'll know exactly how to reach out and get involved. I can tell you as it relates to those action alerts, one happened to come through this morning. 2 hours ago, clicked a button and an email went out to my elected officials, to my senator, and I also went ahead and clicked the button and got connected to their office. And it's important to note that it's not just that they're hearing from you. Every office keeps very careful record of what these calls are that are coming in so that when staff can brief their elected official, they can say, gee, we've heard from a lot of people about the MS research program. We heard a lot of people who were nervous about doing away or cutting back on Medicaid to the point where people are left behind. So these are things that literally take almost no time, and yet collectively, our voices really do have power, and this can make a huge, huge difference. Well, Steffany, as we face uncertainty in NIH funding for MS research, Department of Defense funding for the congressionally directed MS research program, and federal funding for Medicaid, I just want to thank you and the entire advocacy team for everything you do, everything you're especially doing right now to help ensure that our elected officials understand and support the issues that are important to people affected by MS. Thanks so much for talking with me today, and I'll see you next week at the Public Policy Conference.
I can't wait to get together in person. And I will say a thank you to everyone who has participated as an MS activist over the last few weeks and months. And at any point, really, we could not do this work without the advocates. So thank you, John. Thank you, everyone. And look forward to getting together.
That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/394. You'll find that link in today's show notes, so you can easily copy and paste it right into an email or a text. And I hope that your first act of activism is to share this episode of Real Talk MS with as many people as you can. And if you have a minute, I hope you'll visit the Apple App Store or the Google Play Store and download the free Real Talk MS app for your iOS or Android smartphone or tablet. It's the best way for us to stay connected. The app will automatically download the latest episode of Real Talk MS. You'll be able to access any of our past episodes. You'll be able to save your favorite episodes. And it's a great way for me to share bonus content with you. The app is free, so I hope you'll download it today. I'm John Strum. Thanks for listening. Stay safe and make healthy choices.